All right, guys, in the second part of chapter six, or in this part of the video, we're going to be looking at how lipids affect our overall health. In particular, one area we're going to kind of focus in on is our cardiovascular health. Already in the first part, we kind of looked at, what are lipids? What are some of the main examples? Where do you find them? What are they doing in our bodies? Well, now it's kind of like, well, what happens? Why are these important to study? Why are these important to kind of keep an eye on as far as our overall health? When you look at that nutrient label or that nutrient panel on the back of a food product, food item, why is that important to kind of keep up with that number of the total fat content or saturated fat or unsaturated fat? So why are all of these things important for our overall health and nutrition? And a lot of it really does go back to cardiovascular. And so there is a lot of correlation, a lot of studies out there that show that there is a correlation between lipids in the body and cardiovascular disease. And so these are some examples of, this is kind of a big umbrella type of a medical condition here, but it includes things like coronary artery disease. Coronary arteries are those arteries that surround the heart. Their job is to supply the heart with blood flow, oxygen supply, all the nutrients that the heart muscle needs. And so coronary artery disease, if something happens to those vessels, and we're going to talk about, blockages and things, if something happens there, you're not supplying the heart with the proper oxygen supply, nutrient supply, and that can lead to a heart attack or blocking the blood flow to the heart. It could be a carotid artery disease. Carotid arteries are the arteries coming up out of the heart, taking blood and blood supply, oxygen, nutrients up through the neck, going to the head, the brain, facial muscles, and things, mainly supplying the brain with blood flow. It could be peripheral artery disease. Your peripheral arteries are carrying the blood out, to your limbs, to your organs. It could be a stroke. Stroke you could think of as a brain attack. It's decreasing blood flow to the brain. And then hypertension, high blood pressure is definitely a concern or a sign that there may be some problems there. And so let's look at a couple of things here. You may have seen this word before, atherosclerosis. It's a hardening here of the arteries that is usually caused by some type of plaque type substance building up inside of the vessels, inside of the arteries. And there is some studies that suggest that this is definitely diet related. There's again a correlation between how much lipids are in fat content that we have in our foods and how these lipid containing plaques start to develop. You can see from the image here, if you have a vessel, some kind of artery here that's supposed to be carrying blood away from the heart, taking it to our tissues, taking it out, to things like our lungs or our kidneys or liver, our vital organs up to the brain. You could see that if this plaque begins to build up, it restricts blood flow, that increases blood pressure, and could potentially cause a blockage. And so this building up of these plaques could result in CVD, cardiovascular disease, and it may result in a blood clot or a thrombus. Now, the other vocab word here, so a thrombus is a blood clot, but it's possible that blood clot, or at least a portion of it from that plaque, may dislodge and may start to travel. So if you're talking about a blockage or a blood clot that's forming, that's the thrombus. But if that thrombus dislodges, starts to now flow freely, then that's known as an embolus. The problem here is that you don't know where that embolus may get stuck again and may create a blockage somewhere else. It may travel to one of those coronary artery vessels in the heart, and that could lead to a heart attack, not supplying enough blood flow to the heart muscle itself. It may travel and get stuck in vessels supplying blood to the brain, and that would be a stroke. What if that embolus travels and gets lodged or stuck somewhere going out to, your tissues or organ, and that reduces, blood flow out to our cells. It could kill off or damage cells or tissues, and that could lead to gangrene. You may see that in your extremities. That's where the peripheral artery disease comes from. One thing when you're studying about cardiovascular disease, you may have heard of, we're going to look at a couple of these, LDL and HDL. You hear about that, if you go to the doctor, get a checkup, maybe have a lipid study done, lipid panel done, you may hear those terms. Lipoproteins are how lipids are transported through the blood. If you think of the blood, it's an aqueous solution, right? So it's a water-based solution. Lipids are non-soluble in water, and so they need some way to be transported throughout the blood, and so they rely on a lipoprotein, a protein that basically binds to a lipid and allows it to transfer through the bloodstream. And there's different types out there. There's really 4 major categories, and they're kind of shown here based on their different properties and their densities and how well they kind of bind to different lipids. We're going to focus mainly on 2 of these, the ones that we hear more commonly, HDL and LDL. So if you've heard of these before, HDL and LDL, we generally associate these with cholesterol, and that's because that's kind of one of their main functions, is to bind to cholesterol, a type of lipid, and transport it through the bloodstream. Just on their own, though, HDL stands for high-density lipoprotein, and LDL is low-density lipoprotein. So they're both lipoproteins. They're both designed to bind to a lipid, in this case cholesterol, and allow it to transport through the body. Now, a lot of times we confuse, we hear about one's good, one's bad, and so we get kind of confused about, those types of scenarios. So we need to kind of look at that. HDL, a lot of times we think of as the good cholesterol, even though it's a lipoprotein. It's a good version of this lipoprotein because it has the ability to transport this lipid cholesterol away from the tissues, taking it back to the liver, and then the liver is going to process that, break it down so that you can eliminate some of that extra cholesterol. Most cholesterol, we think of coming from our diet. Our body does produce cholesterol on its own. The liver does make some cholesterol. We need some cholesterol in our cell membranes and in things like in our gallbladder, the bile that's there uses cholesterol. Some of our hormones, steroid-based hormones, have cholesterol as one of the components there. So we need some cholesterol. The problem sometimes becomes if we're eating too many animal products. Plants don't produce cholesterol. They have other sterols. But if we're eating too much animal products and that builds up cholesterol, we're not getting rid of it fast enough, that's when we can have some problems. So high density, this is the good one, right? Because it's trying to get rid of or eliminate some of this extra cholesterol that our body really doesn't need. A lot of times you hear the HDL, the H standing for happy cholesterol or happy. This is a good one to have. You want to have a particular amount of that HDL. The bad cholesterol, kind of quote unquote, the lousy cholesterol, if you want to think of it that way, LDL, this is low density lipoprotein. The reason this is bad, I guess, is because, it's doing its job. It's carrying cholesterol out to the tissues, but the problem can become if you just have too much cholesterol to transport out to the tissues, then some of that can break away from that LDL protein and start building up in the vessels. In other words, it doesn't make its way all the way out to the cells. Instead, it kind of gets left over out in a vessel somewhere, and it can start building up that plaque that we just kind of mentioned. So you have to monitor this a little closer to make sure that this is not getting too high LDL. So major risk factors for atherosclerosis. Take a look at these. You don't have to memorize all of these. Notice that we have them divided into 2 categories, non-modifiable and modifiable. There are some things that we just can't change about our overall health and nutrition. We have no impact on our age. We have no impact on our genetics, our family history. And so It may be that we're doing all the right things. We're exercising. We have a great diet. We're a non-smoker. We're watching all of our lipid intakes and things, but we may still have higher numbers of cholesterol or higher LDL or lower HDL, really because of our genetics. And we have a family history of having cardiovascular problems in a family, and so that could be a realistic situation. Maybe have a family history of having high blood pressure, right? And that's not something that we can modify just as simple as watching our salt intake or something like that. There are some, though, characteristics, a lot of these things that we can change. Our overall lifestyle, maybe, we can change our diet, and we can watch for things like how much saturated fat, unsaturated fat is there, how much salt is in our diet. Hypertension, high blood pressure, we can monitor that. We can monitor it. Maybe you even have a blood pressure cuff. You can go to Amazon and get a little wrist cuff. It may not be super accurate, but it gives you a pretty good estimate of what your blood pressure is, or you can get a little bit better cuff for your brachial artery and kind of measure that. And so we can monitor our blood pressure, and we can modify that through diet, exercise, insulin resistance, and diabetes. Can we monitor that? Can we modify that to some extent, because that's related a lot of times to diet. It's a lot of times related to our overall weight and health condition. But again, there's a lot of insulin resistance and diabetes that is genetic, seems to run in a family as well. Blood cholesterol levels, especially that LDL, that lousy cholesterol level, or that low density lipoprotein. Watch those fatty foods. Watch the saturated fat. Take a look at that content. Start kind of thinking about how much saturated fat is in our diet if we're experiencing problems with elevated high blood cholesterol levels, excess body fat, physical inactivity. How much activity physically are we getting? A lot of places recommend 150 minutes of some moderate type exercise each week, or 75 minutes of some very vigorous type exercise each week. How many minutes of that physical activity are we getting on a regular routine basis? Tobacco use. There's studies that suggest and show that tobacco use and exposure to smoke can lead to problems with atherosclerosis. So these are some things that we can change. We can make lifestyle changes to try to improve upon, to try to watch out for this atherosclerosis. I mentioned before, you may go and have some blood work done, and one of the things that you may have checked is a lipid panel or lipid profile, and things they're going to look for: how much cholesterol is in your blood, levels of HDL, LDL, triglyceride levels, or overall fat content. You don't have to memorize the numbers, but here's just kind of what they're looking for. Is your total cholesterol less than 200 milligrams per deciliter? Is your LDL less than 100? Is the HDL at least 60 or even a little higher is actually good, because remember that HDL, that's your good version of the lipoprotein for cholesterol there. And then triglycerides, are you in the 150 or less? Now, in my own experience, I struggle with a little bit of this. I'm working on it. Cholesterol for me is right around the 200 mark, maybe a little bit higher. I usually am right about the border for the LDL. Sometimes mine's a little elevated. HDL, I usually do okay on that. Triglycerides, that's where I struggle just a little bit. The overall fat in the bloodstream for me is usually a little higher than that. And so I'm working to try to do some of those lifestyle changes, watching those fat intakes and trying to increase that physical activity to try to get these numbers back a little closer. The other thing, just personally about me, is I do have a family history of some issues with cardiovascular problems. And so, so it's very important for me to kind of watch those things. But some of that even though I'm working on some of these things, it's more difficult to modify because there is some genetic issues there, that not to put all the blame there, because I know a lot of it's on me. And so that's just some things to kind of think about. What are some dietary guidelines to think about? Well, again, watch those saturated fats. Are we getting 10% or less of our total calories from that category? And so, just by our food, we can't just look at our food and know how much saturated fat, but that's where programs like that nutrition calculator that we're using in Connect, or you can go to MyPlate, put in your diet for the day or the diet for a week, and run a report, and it'll analyze it and say, hey, this is how many calories are coming from saturated fat. Are you at the 10% mark? Are we well above that, or are we below that? Watch out for cholesterol itself. Again, I mentioned that plants don't produce cholesterol directly, so maybe we need to, if we're having a struggle with cholesterol, maybe we need to increase our vegetable content, fruits and vegetables, decrease some animal products a little bit. Especially when you're looking at fatty acids, be careful of trans fatty acids. One of the problems with trans fatty acids is, remember these numbers, LDL, HDL. Trans has the opposite effect of what we are trying to do. In other words, LDL, we're trying to decrease these numbers because these are the lousy ones, but trans fatty acid, that causes that number to go up. HDL, we want a little bit higher of this. Trans fatty acid causes that number to go down. And so they're working against us even more than some other things. So be careful about trans fatty acids. Other strategies, trying to reduce unhealthy dietary fats. Watch out for eggs. Eggs, over the years, there's different research studies that kind of come out, and it seems like one study suggests we need to cut out all eggs from everything. Other studies suggest, well, eggs are actually pretty good, but you need to limit some things. So it depends on what decade you're looking at, or what research journal you're looking at sometimes. But if you do have high cholesterol and you do have a risk of cardiovascular disease, that may be one area you want to look at. Fried foods, of course, you got to watch out for fried foods. Fat in fatty meats, watch out for that. High saturated deli cuts, deli sandwiches, have to be very careful with those. And so choose low fat snacks, nutrient dense snacks, rather than like chips or something. Go for peanuts or almonds or walnuts that, those have fats there, but they're usually more healthy type fats, unsaturated, polyunsaturated fats. Omega-3s and things are part of that group. Lifestyle changes. Fiber, especially soluble fiber, that plays an important role in helping to lower things like cholesterol and fats in our system. And so anything we can do to increase, that's, again, fruits, vegetables, oatmeal, reduce refined starches and added sugars. One of the things we have to realize is that all of that extra sugar and starch, if we're not using it, if we're not burning it as calories, we're going to be storing that. And we're going to be storing that as fats. And so even though we think, well, sugar, that's not a lipid, but it's going to be converted eventually into a lipid for storage purposes if we're not burning it off. So we need to try to reduce some of that. Limit alcohol intake. We'll talk about that in a little bit. Losing excess body fat. Moderate intensity physical activity. Increasing that on a regular basis. And finding something that you enjoy. That's a good strategy. Personally, I don't like jogging. And so, that's a great exercise. It's not my favorite. And so I sometimes struggle with something like that, but I enjoy bike riding, and, I enjoy swimming. And so find something that you enjoy with a physical activity and try to, really increase that. We did a case study with the Mediterranean diet, looking at increasing healthy fish and, increasing fruits and vegetables, increasing things like olive oil for that. The DASH diet, we've got a little work on that to look at, but that's kind of decreasing salt intake, and that helps with things like hypertension. All right, last section we're going to look at here is section 7. They stuck this in here because it does deal with cardiovascular, but one of the things it mentions is in our overall health is alcohol, because we have to realize that alcohol basically, and we're talking about ethanol, if you're a chemist, you know there's different types of alcohols. The drinking alcohol that we drink is ethanol. You can see the little chemical formula there. But one of the things that we don't always realize is that ethanol is really a poison or toxic to our cells. And so just a couple of things kind of mentioned here. We don't really digest alcohol. In other words, here's the formula. There is no digestion needed. We're not breaking these bonds. And so when you drink alcohol, it's kind of ready to go. It goes through directly absorbing into the body. It can be absorbed through the mouth, the esophagus, anywhere along the GI tract, in the stomach, of course, in the small intestines. Now, you do have to detoxify it, even though you're not necessarily digesting it, you're still detoxifying it. And so your body is producing an enzyme. I know this is an enzyme, of course, because it ends in ASE, ACE. Not all enzymes do, but this one is nicely named. It's alcohol dehydrogenase, gastric alcohol dehydrogenase. And so this is taking place in the stomach. This is an enzyme that will work well in the stomach, and it helps to detoxify, make this toxic substance safer to transport throughout our body. Also, the liver is very important in going through this detoxification process for ethanol. There are problems, there are disorders associated with alcohol use, and those that are dependent on alcohol, those would be those that have an uncontrollable need or urge to drink, and especially in excess, unable to limit that alcohol consumption. We're not talking about one drink or a casual drink. We're talking about, uncontrollable drinking. That individual would normally suffer, many types of withdrawal symptoms if the alcohol is not available, and even experience tolerances to alcohol, and so they're always needing more alcohol in the system to have the same type of feeling there. One of the things we have to realize is that alcohol does have a depressant effect on our body, on our central nervous system. And it differs again because of individuals' overall health. What is the impact on that person? Well, it kind of depends on each individual, their overall health, how their drinking habit is. Are we talking about occasionally drinking one or two drinks? Are we talking about binge drinking? Are we talking about drinking every day and that alcoholism? Even genetics plays in a part of that. But one thing we have to kind of realize is that alcohol, no matter the quantity, it can affect any cell in the body, every cell in the body, and it can lead to damage to any tissue, any cell, any organ system that we do have. So we do have to be careful. Now, I know there's a lot of things here. I'm not going to go through all 12 of these, but one thing to kind of point out here in this graphic in the textbook is that alcohol disperses throughout the body. So where it's at, it can affect and it can lead to damage in any system of the body, from the brain, nervous system, to the digestive system, even to the skin, to the endocrine system with the pancreas. So all over the body, to the cardiovascular with the heart, all over the body, you can see effects of alcohol. One of the effects that you do see, because the liver is so vital to things like metabolism and things like detoxifying substances, is that there can be problems with liver and alcohol consumption. And so one of the things the liver has to do is it takes that alcohol chemical, it can convert it into a fatty acid. That fatty acid can then be used as a fuel system for the body. So that fatty acid can go through and you can convert that into energy. But the problem is that puts a strain on your hepatocytes, your liver cells. And so that can create a condition known as fatty liver disease. It basically starts breaking down the liver cells, the hepatocytes. They can only handle so much. They start breaking down, can destroy those, and can lead to those liver cells, those hepatocytes being replaced by scar tissue. This is what's known as cirrhosis. Now, there is cirrhosis that's non-alcoholic related, but there is also cirrhosis that is the result of alcohol, and it basically is creating scar tissue in the liver, which means those liver cells are no longer functioning. They no longer have the same function or physiology that the hepatocyte once did because it's being replaced with scar tissue. The fatty liver part of this is reversible because you can cut back or you can avoid alcohol, and that can help the liver actually improve, and it can decrease that buildup of fat around the liver. Before all of that happens, you can see that even a small amount of alcohol can create some problems inside of our overall nutritional areas because it has an effect on blood glucose. It starts to lower blood glucose levels. It begins to raise blood fat levels, triglycerides, and so these two things are going to stimulate our appetite. So alcohol is taking blood sugar out of the blood, taking it over to the cells. It's raising our blood triglyceride levels, and as a result, that sometimes increases appetite. It also decreases our fluids in the body because it has an effect on our pituitary gland and our hormones that are released there, mainly ADH. And so that basically works as a diuretic, and it causes us to get rid of extra fluid. So it can dehydrate us as well. Too much alcohol actually causes problems with nutrient absorption, and it causes a displacement of some nutrients that are normally in our foods. And so, excessive alcohol, I don't know how much or how often one would have to have alcohol abuse until they started seeing the effects of malnutrition. It's just a possibility. It can also decrease some particularly important minerals in our body, magnesium and zinc. Here's what I was mentioned just a few seconds ago. Sometimes people think alcohol quenches our thirst, but it doesn't really. It actually blocks this hormone ADH. This is produced by the pituitary gland, antidiuretic. It blocks this, and so it actually works as a diuretic. It causes our kidneys to go through the filtration process and a little faster and get rid of extra fluid. Sometimes that extra fluid is also getting rid of minerals and some vitamins along with it. All right. Hopefully that was a little helpful for you to kind of go through the second part of the chapter 6 on lipids. And so please send me an email if you have any questions. Thanks, guys.